Fabulous. Hello, Nikki. My name is Kate Cherry. I was about to say the complete wrong business, but that's what recording is like. So scratch that. So, I'm an independent consultant with Arbonne International. We're a skincare, nutrition, and lifestyle business, and I love to do these health hero interviews. And today I am happy to be here with Dr. Nikki Ramskill. Hi, Nikki.
Nice to be here again.
Yeah, absolutely. Because we've done something like this before, haven't we? With you've spoken at my Athena groups,
Yeah.
and I love. For those who don't know, my other work is the Athena Network, so women's business networking, and we work virtually across the UK and beyond. And I get to meet the most incredible people, and every now and then that dovetails so super well into my health and wellbeing business. And so here we are today with Nikki. So we're going to be asking Nikki a few questions about what she does, how she came to do that, but then also we're going to be talking about pelvic pain and all the things that women experience that count as pelvic pain. So I'm excited to get onto that because there's so many different things that Nikki can help with. So Nikki, tell us a bit more about who you are, what you do, how you came to do that.
Okay. Oh, it's been a long journey to this point. So I qualified in 2009, and I've always been very interested in women's health. And I think probably from the age of about six, which sounds crazy because at the time I didn't want to be a doctor. I wanted to be a teacher, like my nan, who I loved. But she died of ovarian cancer at that point. And I think it really shaped my thinking. Because for ages I wanted to cure cancer, I wanted to get rid of ovarian cancer, and then I realized I hated the idea of being a researcher, so that was never going to happen. But it really made me interested in women's health. And even now, and she's six, I'm 40 now, women's experience with ovarian cancer hasn't really changed. I mean, yeah, we've got a few new treatments and things, but we're still diagnosing it late. We're still diagnosing it when it's stage three, stage four, and you can do a lot, but often can't cure it. And that makes me sad. So that was going to be the obvious choice for me. I did obstetrics and gynecology for 4 years in a hospital, various hospitals in London, delivering babies, doing surgery, crazy stuff, and then just got utterly burnt out. Like I literally couldn't do it anymore. And I realized it's because I was doing something I didn't really enjoy. I enjoyed menopause and contraception and talking about sexual health and things like that, but the surgery just didn't float my boat. And I think that's what did it. But then I got told, well, if you want to do all of that, you're not really going to get to do that in gynecology because there aren't very many jobs, and you'll find that you'll have to compete with other people, and a lot of these jobs are already filled. And so I just kind of gave up on the idea through obstetrics and gynecology, and I left because I thought, well, there's got to be ways that I can do it. And there was a number of different options, but the one that I ended up settling on was becoming a GP because it covered everything, and I was missing other elements of healthcare as well. Looking after children, looking after men. I quickly got over that and still really love women's health, but then becoming very disenchanted with how the NHS deal with it. Um, there was all this money that was promised for all these health hubs for women in the UK, that 75% of which disappeared because it wasn't ring fenced and people were mismanaging it or using it for their bottom line. And it really saddens me how women's health seems to be this neglected area, even though it makes up, in more than 50% of the population. So I then got diagnosed with something called premature ovarian insufficiency. It was essentially a kind of menopause before the age of 40. So my levels were all bad. And my only option at that point was to look at donor IVF, donor eggs IVF. And I just didn't want to put my body through it. I'd had enough. I'd had a miscarriage. I just wanted children at that point. I didn't want to have to run the lottery of am I going to get this or not through IVF. So we adopted, and that was the next bit of my journey. But between deciding whether we were going to have kids or not and adopting, I also started my own private clinic because at the point I didn't think I was going to have kids. I thought that would be it. I'd never be able to do it because my ovaries have packed up early. That's it. So I started the private clinic last March, and it took me 9 months to get to that point. I had to jump through loads of hoops for the CQC and everything, because I wanted autonomy over how I looked after women. I wanted to be able to bring their diagnosis, down so they're not having to wait several years. I wanted to get them to fast track to seeing the experts for IVF and things, not waiting for several years before they got there. Looking at innovation and looking at what's coming up and looking at the different medications that people can access that you can't get on the NHS and tests you can't get on the NHS. So that's why I started it. And then we found out that, well, we were very eligible for these two little girls, and 9 months later they moved in. So in about the space of 12 months, I've started a business and adopted, and somehow I've made it through the other side and not, completely spontaneously combusted at this point. So it's fine. It will be fine.
I love that. That's such an amazing story. Because when you and I first met, you worked in, it was more money coaching as well. So you were the money doctor.
Yeah, because it's because wealth and health are so intimately intertwined. If you haven't got your wealth sorted, then when you're older, you run the risk of not being able to afford things, not being able to give up work, not being able to have the care you need. And this is why we've got so many people stuck in situations they don't want to be in when in their 60s and beyond. So I could see the correlation and the links, but I think COVID kind of hit, and then the miscarriage thing happened, and I just lost the steam for it because it just felt like I could tell somebody how to budget, I could tell somebody how to invest, but unless women are earning more money, it's just not going to happen. And that's a big part of the money problems for women, is they're not earning enough.
Mm.
So yeah, and then that ties into things like menopause, where people are giving up their jobs because they can't do it anymore. Their menopausal symptoms are getting in the way. Pelvic pain, another huge area that women are just not able to function through for several months of several weeks of the month, just because we haven't diagnosed them properly, or we haven't got the tools yet to treat them properly.
That was an incredible segue there, Nikki. I think that's brilliant, because that's exactly what we're going to talk about, isn't it? So firstly, how old are the girls, by the way?
So they are now 5 and 6. They were 4 and 5 when we got them, and they've both had a birthday since they came out. So they are very full on, but lovely. Yeah.
Congratulations.
Thank you.
So pelvic pain, I tend to have being tall. Don't know if it's because I'm tall, and also I had SBD when which they don't call it SBD anymore, do they? But when I had my first, and then so it was more managed with my second. So I've always had kind of SI, so sacroiliac, hip type pains, not all the time because I know how to manage it now, but it's all around. You learn that it's all around the muscles around the pelvic. It's your pelvic belt and floor, and you need to look after all of that to hold it all together, which is something we don't teach young people enough. So I love that this generation is learning more about muscle build and looking after their muscles when they're young, because we were just relying on whatever we were relying on when we were young, and then everything sort of falls apart once your hormones go to pot when you're having a baby or then perimenopause. So, but when you and I were talking about pelvic pain, that there's that notion of actually the other side of pelvic pain is the internal organs, female organs, and all the different aspects that women can be affected by. So tell us more about that, and because I know that's an area of your work that you're very passionate about. So it'd be great to get some sense of the things that people, like you say, live with, but can get help on. Yeah. Go for it.
So I suppose starting with things like endometriosis is probably the right place to start, because that's the one that's got the 8 to 12 year waiting time for people to actually get a diagnosis, which just sounds ridiculous when you say it out loud, doesn't it? But it does take that long, and it's usually because women are not taken seriously. So there's a lot of what's termed as medical gaslighting. Now, some people in the medical profession get very upset about those sorts of terms, because they feel that they're not gaslighting women, they're just trying to make them realize that they've got to be realistic about their health. No, if you're telling somebody that they're just anxious and it's all in their head, and yet they're in pain all the time, or at least for several weeks of each month, there is something going on. Even if it ends up being an issue where their nerves have become sensitized to something that happened before, and now they've got chronic pain as a result, it's still pain. They're still experiencing that pain. So to say it's just all in their head, or they're just being anxious, is just really doing women a disservice. So that's part of it. But then there's also so many other things that can cause pain inside that area. And oftentimes it's blamed on things like irritable bowel syndrome. So, oh yeah, you must have irritable bowel syndrome because you're getting bloated, you're having some diarrhea, then you're having constipation. Yeah, there may well be an element of that, because endometriosis is one of those conditions where we just still haven't really worked out what the cause is. There's new research that's coming through that's saying it's bacterial causes, it's autoimmune, it's inflammatory. So if you've got IBS as well, or you struggle with the two things, they can be very intimately linked. But just to rule, pass somebody off and say no, it's IBS, it's not anything else, is also doing them a disservice. It's so poorly understood. I used to be told in obstetrics and gynecology when I was doing it, it was to do with something called retrograde menstruation. So endometriosis is essentially cells that are a bit like the lining of the inside of the womb that shed every month and bleed, finding their way into other parts of the body. So they could be in the brain, the lungs, they could be in the abdomen around the diaphragm, it could be around the liver, they could be on the bowel, on the bladder, anywhere. Now, the problem with that is that that is inflammatory, and it basically causes its own little inflammatory reaction in the area that it sits in. So you end up with bleeding, you end up with scarring, and essentially all of the organs kind of becoming stiffer and becoming fused together because of all this scarring that's happening, which, as you can imagine, would cause a lot of pain because our organs like to move. You need to be able to move freely so you can get your stool through it, or you need to be able to fill your bladder properly without it hurting because we've got to store our bladder or urine somewhere, haven't we? So that's what endometriosis is. And then when you've got this inflammatory process going on, and if it's infecting your bowel, you are going to get potential things like constipation, diarrhea. If it affects your bladder, you might get irritable bladder type symptoms where you're filling up your bladder and then needing to wee very quickly all the time. So it's very easy for then somebody to say, oh, it must be a urine infection or it must be something else, rather than the root cause, which is the endometriosis. So that is why I think it takes so long for somebody to get to that point. But what you need is to speak to the people that understand it, the right people from the start. And unfortunately, often what happens is you get referred to gynecology. A gynecologist who's a generalist, they're not a specialist in pelvic pain, will then put a camera inside someone's belly button to have a look around. They might stick a probe in as well to sort of like flick things around, have a look around the back, but they won't be trained well enough to be able to spot subtle signs or anything like that. And endometriosis doesn't correlate with, if you've got lots of it, you must be in so much pain. If you don't have very much of it, it must not be in very much pain. It can be, you might not have very much at all, and it can cause you serious pain. So then that person says, oh, you haven't got endometriosis. They've missed perhaps the subtle signs, and they send them home back to their GP again. And then that person's left for another couple of years in pain. And all they're told is get pregnant. It's one of the things, because if you switch off your hormones through pregnancy, well, not switch them off, but stop them from cycling through pregnancy, that can help to keep it calm, keep it quiet, because we don't have periods, shouldn't be having periods during a pregnancy anyway. It's the same with endometriosis. It kind of calms everything down. So that's one of the cures that people were said, go and get pregnant, which is ridiculous, or go on the pill, which is what I will often say to people as well, because it does help. So if somebody needs contraception, going on the pill, having a coil, having some kind of birth control can really help. But it's not the only thing. That's the problem. You need to be looking at your diet. You need to be looking at your lifestyle. You need to be looking at so many other things to help improve it. You can't cure it unless somebody goes in and physically cuts it out. But even then, you don't necessarily cure it. So you do ultimately need to be seen by a specialist who can have a look in properly to do any treatments that are required that way. Sometimes quite big treatments are needed. Women can lose bits of their bowel, they can lose bits of their bladder through it because they have to have it physically removed and cut out. It can affect your fertility. It can affect things like brain fog. So you get, you feel like you can't think straight half the time. Fatigue, not being able to go to work properly because you can't physically get out of bed because you're so tired. It's not just that little thing that we treat with contraceptive pills. It's so much more than that. So yeah, it's a big part of women's health.
And that's something that you hear about a lot then. So people, as a private GP,
Yeah,
you have quite a few people that come to you who've
Yeah.
tried to get the help they need and
Exactly. They've got to wait. So, I've had people that have said, "Oh, you've been referred to gynae, but there's a 64-week wait." So okay, so that's over a year. You've got to wait just to have that initial conversation. So you've got to wait all of that time with no guidance,
Hmm.
expect to just kind of get on with it and be okay at the end. So that's why I put together specific packages for women that are in that situation.
Mm.
Um, Another one that's not the same as endometriosis, but can kind of be similar is something called adenomyosis. So that's where those cells that are like the lining of the inside of the womb, not going anywhere else in the body, just going into the muscle of the womb itself. Now, I've diagnosed that in a 17-year-old because her parents said that she was in so much pain she needed to be seen. So we sorted her out with an ultrasound. We did some blood tests. We did some swabs just to make sure there were no infection markers or anything. And that's what came out. And I used to think adenomyosis was something you got as you got older because you've had kids. Any kind of trauma to the womb can increase your risk of developing it. But clearly, it can also affect young girls as well. So there's not really much you can do about adenomyosis, unfortunately, apart from remove the womb. And you can actually cure that condition. But in a 17-year-old, you're not going to remove her uterus because she hasn't even had a child yet. So in that situation, birth control,
Mm.
coils, all of that sort of stuff can be really useful. Um, so yeah, they're two very common things that I see, and that's why I put together these things because I was just so sick of people having to wait so long just to get an answer. And often in 17-year-olds as well, people will just say, "Oh, don't worry, you're fine. Come back when you're a bit older." But actually, that's probably a good time to start looking into it. And we may not have found anything in her, but because we found it, we can now sort of manage it, and she's got the expectation of what's going to happen over the years. Whereas if you hadn't done that, perhaps she would
Yeah.
have been gone for years suffering, not knowing what's going on.
And you, how would I get a sense of the fact that, well, yes, you might say, actually, let's look at something in a few years. You would also, at the same time, send someone away with advice of
Yeah.
lifestyle changes they can make in the meantime. Because I almost get the impression when I see normal GPs that on occasion it's sort of been, they're looking at something purely from the medical perspective, particularly consultants actually, or surgeons, whether when it's something else. Um, and they sort of half-heartedly mention the lifestyle aspect of things. Oh, there's some research to indicate blah blah blah, so you could look at that kind of thing. It's not. It's sort of, this isn't in my realm. I do
Yeah.
medication and surgery, therefore you can go and look at that if you want. There might be there's some science behind XYZ or research coming out about XYZ and inflammation, etc. But it sounds like you would send someone away with some solid,
Yeah.
you might want to look at this, this, and this as well.
I would, yeah, and I would make recommendations for people to go and see. So that's one of the things I love about networking because you can come across, as you said, incredible people that do
Mm.
really niche things. And don't get me wrong, I am interested in so many things. I could learn about so many things. There's all this stuff around functional medicine and all the pathways that are impacted by what we eat and how our body responds to that and how our hormones are broken down. And it's incredible. It's so much detail that we are aware of. I don't have the time to sit and
Mm.
learn about all of that. But I know people that do know that and I
Mm.
can refer them. So I know people that can help manage endometriosis through diet control. So things like the AIP diet, which I always get this mixed up, but I think it stands for autoimmune protocol, which
Mm.
basically means you're eating things that are reducing the inflammation in your body
Yeah.
and avoiding things that increase the inflammation in your body. So there's things like that that can really help with endometriosis. But I think it's also really important to be guided by a professional
Yes.
because what if you're eating something you think is healthy, but actually it's making things worse because of the way your
Yes.
body breaks it down or whatever. So it
Absolutely.
to me, it makes sense that you use your professional colleagues around you.
Hmm.
Even things like osteopathic care, chiropractic care, that can all be really useful for exactly the sort of pains you were describing in your bones and hips and everything. Why not speak to an osteopath and see if there's any alignment issues that you need to look at? There's so many things that we can do that I think just because we don't necessarily understand it ourselves doesn't mean it doesn't help.
Absolutely. Yeah. And sometimes it can be such a simple thing. There's not necessarily, I used to, before I knew so many wellbeing professionals, let's say, I had a tendency, probably like a lot of the population, to think if something hurts, it's broken. So the first thing I had investigated was, and this isn't about this isn't about the womb or anything, but again, this is back to the hip. It's just an example. I had pain in my hip and then pain in one of my lumbar, sort of an angle between the hip and the lumbar. And after scans and stuff, it was, oh, well, you know, you've got sort of early arthritis on the top of your femur. So they say hip, but actually it means the ball at the top of your femur is actually oblong. So it's rubbing a bit. And there you go, and you'll probably need a hip replacement by the time you're 50. And so this is in my 30s, because that's the surgeon speaking, right? That his job is to cut people open and fix things. So it's, I'll see you in, no, what can you do, blah, blah, blah. But now interestingly, the pain went away immediately because I then knew what it was. But my instant reaction, and his obviously as a surgeon, was, oh yeah, well, the only thing you can do is surgery later. But I now know that, you know, what arthritis is, it being a bone growth. Yes, inflammation causes a lot of this pain, and you can reduce that inflammation through what you eat. And, oh, well, you think that eating tomatoes and this, that, and the other is healthy, of course, but actually they're inflammatory. They're not, nightshades are inflammatory and can affect your joints. So I meet a lot of people through my work who say, oh no, I eat healthily. But depending on what they've got going on in their body, something that they may consider healthy might not be the thing they can have. So for example, pepper for people with, diverticulitis, for example. There are certain things that set off certain inflammation, isn't there? And so it's great that people are thinking about eating healthily, but that's great when you have a blank canvas, when you've taken things back to zero and your gut's healthy and everything's healthy.
Yeah.
But what you think is a healthy diet on top of an existing issue could actually be totally the wrong thing to do. Yeah, so it's great that we have these professions that can sort of work together, like you say, and you've got that exposure to, I mean, even nutritional therapists. The person who introduced me to my Arbonne business, Emma Burden, is now a BANT registered nutritional therapist, and it's exactly what you say, those functional pathways of all the different things in your body that affect the others, and the different hormones, vitamins, minerals, everything you consume that interacts and affects other things is just bonkers.
It's mind-blowing.
Mind-blowing. And the average, you are one, so you'll be able to tell me, the average GP actually only gets a week's nutrition training, is it, or something?
Yeah, I was thinking about this. I think I only got, I don't even know if it was a week. I think I had one day, one session.
I think someone told me recently it was a few hours, yeah, but I'd heard a week. Yeah.
No, I mean, every medical school will be different, but I think I remember one session with a dietitian, and the bit that I actually remember from it, which is ridiculous, is I used to work for Holland Barrett. So while I was during my medical training, on a Saturday I'd go and work for them. So I was learning about the different herbs and things like that you could use for, things like depression, so St. John's wort, for example. So none of that kind of surprised me when we were talking about it in medical school. I think we covered it over a couple of hours. And I remember the lady saying to me, yeah, I don't rate Holland and Barrett professionals for what they tell people. And my friend just sort of giggled at me, and as if to say, oh my God, she's aiming that at you. And I went, I know she's aiming that at me. And she said, I stand by that. I think that what Holland and Barrett tell people is utterly wrong. Oh, right, okay, but I don't remember anything about the rest of it.
Yeah, you just remember that interaction.
That interaction. But the problem is that all of that stuff that I learned back in 2007, 2008 is all out of date now.
Oh, totally. Yeah.
And the things that the NHS are telling people about, half your plate has got to be this, a quarter of your plate's got to be that. Yeah, okay, fine to a certain extent, but actually some people do better if they go on low carb. Some people do better if they go Mediterranean. Some people do better if they eat certain things, not eat certain things, as you've said about all the different pathways. So that kind of blanket approach is no longer the right thing to do. Everything's got to be so individualized and so bespoke.
And some
Uh,
people have to be incredibly careful of fibre. My father-in-law had his, and I might be getting this wrong, but I know fibre is something he had to watch out for because he had he had his stomach, most of his pancreas, well, in the end, all his pancreas and some of his intestine removed.
yes.
Still managed to survive a good number of years without those. But so fibre was an issue for he couldn't have too much fibre.
Yeah, yeah, exactly.
Depending what's going on in your body, you know, things that are traditionally healthy.
Yeah, I was learning about histamine intolerance syndrome because I've had a patient recently who I think has got it, and it was one of those areas that I kept meaning to sort of learn about. And I thought, right, I've got a patient now. Let's actually do some reading and research into it. And what really interested me was that a lot of the things like kombucha
Mm,
can actually make histamine intolerance syndrome worse. And we're told, have kombucha, it's really good for your gut. But if
yeah.
your gut's broken,
Yes.
these sorts of things is just going to make things
I
worse.
know. That's a super example because my husband had, and obviously I'm meant to be talking about your work, but
That's
a
all right.
nutritional therapist helped my husband with a whole bunch of things going wrong, like brain fog, bad sleep, stress, tummy issues. And she put him on a health optimization plan, so a protocol that was low histamine. And exactly that are some things he couldn't have. So he couldn't have high histamine things like, oh, and he hated this, but tomatoes, avocados,
Yeah.
all of those high histamine things. But he couldn't have anything fermented or vinegars
No.
as well. He could have cider vinegar or lemon in dressings, but he couldn't have that. And for that exact reason, because of the histamine, which is really interesting, isn't it?
Yeah.
Who
Just
knew?
is it exactly that? You don't know. And this is the thing with things like endometriosis. We don't know enough. I mean, we're learning, but we still don't know enough. And
Mm,
actually, I think the nutritional therapists can teach us so much about our bodies in a completely different way.
mm,
So yeah, it's important. You have to meld those two worlds together. You can't just do one without the other. It's it doesn't work.
yeah. I think one next step would be doctors actually referring to nutritional therapists. So
Absolutely.
in your work, that's incredible because you've met so many people, and I know some of the people you know through our community, and I mean,
Yeah.
what is there that we haven't got covered? I think so. It's great to know that you would take the initiative to do that. So let's bring it back to you. If you had a call to action on how people can engage with you, where do you operate, how do you operate, how can you help people that, if people need to contact you, just go for it.
Yeah, sure. Okay. So my clinic is based in Milton Keynes, but we do online appointments and telephone calls for people as well. So actually, I've had a patient recently who's based in Northern Ireland. How she found me, I don't know, but I'm very grateful she did because it was lovely to work with her. But so we kind of cover all of the UK basically, and we can do all sorts of things. So if it's a scan somebody's after, we can find a scan that's local to where they live. If it's a swab or something like a smear test, we can post it. It's something that we don't actually have to see you physically in clinic anymore. But it's always lovely to see people in clinic because, we've lost that through COVID. I think we do so much more online now, don't we? But to get in touch with me, it's probably easiest to go on my website, thefemalehealthdoctor.com. There's like a little pop-up that you can go on to. I also do discovery calls for 10 minutes. So if you look in the drop-down menu of all the different appointments that are on offer, free discovery call is there right at the bottom. So that's quite a quick way of booking in as well, because it means you can speak to me straight away. So yeah, I'm on Instagram and TikTok and all the usual. So female health doc is my handle for pretty much everything. So there's lots of ways to
And
find me.
if anyone has a business near the Tring area, they could visit your Athena Tring meeting, couldn't they, and meet you?
Absolutely, yeah.
Because
That's
that's where you belong, and you've had a membership with your two businesses, haven't you? So now you're here
yeah.
with.
Now it's just the private healthcare because it just feels like such a privilege to be in this situation, but also I love it. I really enjoy it. So now it's just navigating how am I going to progress my career through this. Because unfortunately, it looks like I'm not going to be able to work for the NHS much longer unless you do a minimum number of sessions per year. But when you're running a business and trying to look after two small people and trying to have a, remnant of a life, how are you going to do everything? So yeah, it looks like that's going to have to fall by the wayside by the end of the year. But
Which
hey.
is such a shame, isn't it? When I think about why I left my corporate job, I would have gone to more part-time, for example, but it
Yeah.
wasn't possible with my client-facing role. Had we thought about it a bit more and had I actually spoken to HR, they would have found a way. But that immediate client-facing, so it's such a shame, isn't it, that the NHS might lose such a talented GP because of that.
Yeah, it's just too restrictive. I just find it
Yeah.
too restrictive. And when you've got that kind of entrepreneurial mindset and that, you're wanting to change things and improve things, NHS can be quite stifling. Even if you got to a certain level, you still wouldn't be able to change things because it's just it's like a massive behemoth of an iceberg that you just how are you going to move that?
Yeah, I totally understand. Thank you so much for your time, Nikki, and for sharing all that wonderful knowledge. I think I'm officially giving you the throne as our resident GP in my VIP. So I'm sure we'll be back because there's more we were talking about that you could share with people and help people support people with. So we'll do this again. But thank you very much for your time. And for everyone else, you will be able to find Nikki's links in wherever you found this. And for me, you know where to find me based on where you found this too. So take care and see you soon.